Okay, so we would also like to seize this opportunity to acknowledge the presence of Dr. Divan Bariabala, that is registrar from Medical and Dental Council. Okay, so still introducing our guests. Let me seize this wonderful opportunity to also acknowledge the presence of one of our big men over here. In the name of Mr. Richard Apia AJ. You can do better. You can do better. Mr. Richard Apia AJ holds bachelor's degree in management studies from the University of Cape Coast in project management from GEMPA and currently awaiting graduation for MA in health law and ethics from the University of Ghana. He has vast experience in management and medical regulation. Mr. Apia AJ has worked in all the units of the Medical and Dental Council except the account unit. He has worked for 17 years at the council and has rose through the ranks to be the head of registration. He has headed the registration unit for 12 years. Through his leadership, the registration unit has seen a lot of transformation, including prompt processing of application, registration online, and renewal of licenses online. Retention certificates and hitherto delayed for months can now be accessed online. He loves to work out and has a passion for organization. Let's give him a tremendous round of applause once again for having him in our midst. So fast forward, I'll also like to seize this opportunity to acknowledge the presence of some of our local presidents. So we have Emmanuel Kwachilabi, His Excellency from Radford University. We also have in our midst His Excellency Martin Akomia from Pentecost University. Please show by hand so that they can see you. Okay. We also have in our midst the General Secretary for PASAG Radford University. So once I get a list, I'll continue with the remaining executives. So we are about to take our first speech from our guest, and thank you. So we would like to have our first speech from our chairperson, Professor E.S.K. Mohe. Let's clap, let's clap, let's clap. With a standing ovation, with a standing ovation, let's welcome Professor E.S.K. Mohe to give us his first speech. You can do better, you can do better.
Right. I'm expected to speak on maternal mortality in relation to universal coverage, health coverage. reducing avoidable mortality. And so, my message is directed at physician assistants specifically, because it is our week celebration. I'm part of the Association of Physician Assistants. I've been a patron for the local association for quite some time now. So let me begin by saying, as I usually do, prevention is better than cure. Because I believe that with effective prevention and promotion of health, we will reduce the rate of mortality, not only among women, but in the general population. And I also believe that the earlier we start promoting health, the better. The earlier we start taking measures to prevent morbidity and mortality, the better. If we do not prevent morbidity, that is ill health, we will be overwhelmed. And we will not be able to achieve universal coverage of health in the country. So I still believe that prevention is better than cure. And physician assistants are in the center of all the effort to prevent avoidable deaths in the country. Please, can you move the slide? It's not moving. Okay. Right. So move. Okay. All right. So, as I've already indicated, prevention is better than cure. The earlier, the better. And maternal mortality is real. And I wish to indicate that when problems arise, the three delays are real. Delay in taking the decision to seek health care, delay in arriving at the health facility, delay in getting care within the facility. These are real. There is no doubt about it. They are real situations that everyone encounters in this country. And when the inevitable happens, the unexpected, maternal death, because it is every pregnant woman's expectation. It is the expectation of the family. It is the expectation of the spouse that there will be a healthy mother and a healthy baby at the end of pregnancy. So when the unexpected happens, that there is a maternal death, it is a tragedy. And the news is often greeted with what? Yells, words, everywhere. And that yelling and the cries that you hear are usually short-lived. And if you have lived in a rural community before, when some of us were young, electricity coverage was not that high as it is now. So we happen to live in rural areas where you may not even have electricity. So when there is a maternal death, you hear the cry everywhere and the goose pimple. And if you have witnessed maternal death before, you will actually understand what I'm talking about. And the yell, the shouts, and they are short-lived. And they are overtaken by a cloud of uncertainty. Uncertainty about life. The children will be worried. Who takes care of them? The husband will be worried. What is the way forward? And that one is long-lasting. And so it is a tragedy. It is a condition that is well recognized in Africa long before the current civilization or modern civilization. And the evidence is in the way such mortalities are treated in the traditional society. You see that when there is a maternal death, they do not want to bring the death, the disease, into the community for the fear that that tragedy will reoccur. It may befall some other person. And so that is their level of understanding at that time. So it's very important to work on maternal mortality. And so, what is maternal death? As you can see, it is a death of a woman while pregnant or within 42 days of termination of the pregnancy. That is the end of the pregnancy. It could be delivery, it could be abortion. And irrespective of the duration and site of the pregnancy, it could be ectopic pregnancy. And from any cause related or aggravated by the pregnancy and its treatment. So whatever treatment you offer may aggravate the situation. Once the person dies within that 42 days, it is maternal mortality, but not from accidental causes. For example, RTA. That does not constitute maternal death. The common causes of maternal death in Ghana include obstetric hemorrhage, usually in form of antepartum hemorrhage, postpartum hemorrhage. It could be bleeding from abortion, incomplete abortion. That causes death. Then hypertensive disorders. Here, I would like to make a point. In the teaching hospitals and large referral hospitals, hypertensive disorders have become number one cause of maternal mortality. So if you come to whole teaching hospital, number one cause of maternal mortality is hypertensive disorder. But countrywide, it is hemorrhage. And abortion-related complications. And then anemia, sickle cell disease, ruptured uterus. Next. Sepsis, when women deliver under unhygienic conditions, they get infection. That infection results in mortality. And then thromboembolism. It is becoming common nowadays because of our dietary habits. And then acute kidney injury. I'm sure you are all aware of the shortage of dialysis machines and the cost of dialysis in the country. Acute kidney injury is associated with obstetric hemorrhage and hypertensive disorders. What is the role of the physician assistant. If we are focusing on maternal mortality or improving maternal health as a way of striving hard to achieve universal health coverage. The PA is a general practitioner. The PA is a clinician. PA attends to all categories of patients. And so in the context of improving maternal health, PAs, irrespective of the level at which they provide service, can actually influence maternal health. Because if you are in the pediatric department, the PA is supposed to educate the mother on nutrition. With good nutrition, the girl child attains full growth potential and will have less obstetric complications. If you are in internal medicine or surgery, you are expected to educate people. You link the care that you are giving to maternal health. So you educate them on complications associated with pregnancy and the need to plan pregnancy. Pregnancy by choice, by chance. And the PA is expected to provide or help provide preconception care. And as I indicated, you link up whatever care you are giving to preconception care. When you are attending to a sickle cell patient, you educate her that your sickle cell disease has to be managed properly before you become pregnant. If you are attending to a diabetic, you educate that diabetic woman before you become pregnant. And so, irrespective of the clinical side, the PA performs that role of educating the mother. So, conception care is and the of patients for maternal care. And the PA is expected to screen the patient fed them very early for maternity care. A lot of work to do. Is well connected because at the district level, that's the sub-district level, particularly in the underserved communities, the PA is well recognized. He is among the VIPs in those communities. The PA knows the politicians. The politicians know the PA. And so I will expect a PA who is well connected to be a good advocate. And so the PAs can contribute to development of the community, including impressing upon the politicians to develop the road as well as water and other infrastructural development in the district. And the PA is expected, or the PAs do optimize antenatal care. They prevent and treat medical disorders in pregnancy. Because I have worked with a number of PAs in the district. And what is usually done is that midwives are trained to take care of normal pregnancy. So if a pregnant woman develops a health problem, the midwife refers to the PA. So as a PA, you are expected to evaluate that pregnant woman. If he has a condition that is beyond your capability, you refer. Otherwise, the PA is expected to offer effective treatment. The PA is also supposed to collaborate with the midwife in ensuring that labor and delivery is safe for the mother. The PA is supposed to know how to interpret the pathograph and help the midwife refer the patient or the woman appropriately. The third stage management, the PA is supposed to know how to conduct it. Because if the fourth stage of labor becomes abnormal, the PA will be called to intervene in assisting the midwife. So the PA is at the center of improving maternal health. The PA is also expected to give effective support in services such as transfusion. Transfusion. Please, it's not transmission, it's transfusion. Laboratory services. And you know that some PAs also work as nurse anesthetists. And so the PA has a lot of work to do. Or I would say that the PAs do a lot in ensuring that there is good health for our women. And then PAs also manage postpartum women. When women develop postpartum complications and they come to the postnatal clinic, they are referred to see the PA. So the PA does a lot. Then, family planning and contraception. This is in the center of ensuring healthy mother. Family planning is a primary preventive measure. If there is no pregnancy, women will not die from pregnancy. And so, family planning is supposed to help the woman plan her life, to decide on when to get pregnant, how to space the children, and when to stop having more children. So family planning is very important, and PAs are part of the team that promotes family planning, that offer family planning services in the sub-districts. And abortion care. Abortion care, the PAs are expected to provide comprehensive abortion care. And they are also expected, there is a medical officer. I know that PAs don't like to hear this. I've been part of the group. I'm a patron to the PA club in the university. I am aware of that. But how it is written, how the policy is, you need to know. That is the policy. But the question is it applicable at all settings? The answer is no. The PA and medical doctors, they are independent professional groups. And they work as a team in ensuring that there is access to health care. Antagonism does not help either group. What we should know is that we need to work as a team. And the PAs, you are not underrated. PAs are middle level. But when it comes to universal access to health care, the PA is at the center. Then behind the PA are a number of healthcare professionals, including the nursing group. And then at the top, we have the physicians. The physicians are fewer. The PAs are a lot when it comes to prescribers. And so the PAs hold the healthcare system running. And we all cannot be at the top. Some have to be at the middle in order to hold the system running well. That does not mean that the PA should remain where it is. You can progress to the top. I often hear that there is no career progression. That's not correct. There is career progression. And so please, let's move on. Okay. Then, by improving access to vital care, health care, the PAs have reduced maternal and neonatal mortality. So, last slide. I would say that by collaborating with other healthcare providers, the PA does a lot in ensuring that there is access to maternal health. PAs are very instrumental in enhancing maternal health, and PAs play a critical role in attaining universal health coverage in Ghana. And so when you speak about universal health coverage, you cannot attain universal health coverage in Ghana without the PAs. Thank you very much.
That's very powerful. That's powerful. Let's keep clapping as our chairperson is going to take a seat. Let's keep clapping. Indeed, pregnancy is by choice and not by chance. And the PAs, we play a vital role in general health care. So, we would like to take one or two submissions or questions from you before we proceed from the presentation you have just heard. So, if you have a question, you can kindly raise up your hand so that Professor can clear it for you before we proceed. Thank you. Any question? Please, do you have a question? Okay, so I assume each and everyone over here understood everything that was presented. So we are moving forward. So let's use this wonderful opportunity to acknowledge the presence of the Western North Regional Chairperson for the Ghana Physician Assistant Association. This is our mother association. That association gave birth to the Student Association, and GPAA is the mother association. That is Ghana Physician Assistant. Western North Regional Chairperson is a name